Hello, everyone, and welcome back to another episode on my podcast on my YouTube channel. I'm Dr. Judy, an internal medicine physician, Christian physician, holistic wellness expert. And today I have a very special guest that I am so excited to interview and chat with, Dr. Simran Malhotra. And she is a palliative care physician. She is a lifestyle medicine physician. She also has certifications in coaching as well as culinary medicine. And she is into all things holistic wellness as well. And I love it. And not only that, she also has a personal health story, health journey, which is completely transformative and that you guys are just going to love and be inspired by. So welcome to the podcast, Dr. Simran.
Thanks, Dr. Judy. I love talking to you as always. There's so many common interests, so I'm glad we're able to make this happen.
Yes, absolutely. So to get started with today's episode, can you share with our audience your journey, your health journey when you discovered your genetic mutation and where that took you?
So I'll take you back 10 years. So I'm 36 today. And when I was 26, I found out that I carried the BRCA1 genetic mutation. As I was telling you just before we jumped on, I have an extremely strong family history of breast and ovarian cancer. So cancer and I first met when my mom was 33 years old. I was just 13 at the time. And the youngest woman on my mom's side of the family who had ovarian cancer was 30 years old. So very strong penetration of this gene. And basically, soon after another loved one got diagnosed in 2014, my mom decided to pursue genetic testing for the second time. And this time they found that she carried the BRCA1 genetic mutation. And a year after that is when I decided to also get tested because I was just about to get married. And so it was something I thought my husband should know what he's about to get into. Right. And so, 26 and find out about this genetic mutation. Just for your audience's reference, the average woman's lifetime risk of breast cancer is about 12%. So that's one in eight. For me, with my family history and this genetic mutation, basically my statistic was I had an 87% lifetime risk of getting breast cancer. Yep. And a 50 to 60% lifetime risk of getting ovarian cancer, among a few others as well, like a little bit higher risk of pancreatic cancer, skin cancer, and some others, but mostly breast and ovarian cancer. At the same time as I started navigating this patient journey of like meeting with all these doctors and screening and MRIs and biopsies, I was also doing my fellowship in hospice and palliative care. This phase of my life was probably one of the toughest phases that I have gone through to date, because as I was uncertain about my future, I was also taking care of people, many of them with breast and ovarian cancer, some of them even with the same genetic mutation as me. And so there were days where like the fear, the anxiety were paralyzing. So I almost sometimes felt like I had a window into my future.
Wow, that must have been so scary.
It was so scary. And I look back sometimes and I'm like, thank God, we were just talking about this, like, thank God that I met my husband when I did, because he was such a huge foundational pillar as I was not only learning what it meant to be a palliative care physician and, figure out my boundaries in caring for people at the end of life, right? Mm-hmm. That boundary of empathy and compassion, not crossing it so that I could actually function as a human being, but then also kind of trying to figure out what this mutation means for my future. And so it was crazy. I mean, just to fast forward, right, find the mutation. Then as you and I were talking, basically the doctors gave me a map. Like, okay, you're 26, your mom was 33 when she was first diagnosed. So you need to have kids, get married, have kids, be sure you're done having kids, and then basically have these risk-reducing surgeries. So fast forward, I got married and we had our kids 19 months apart. And then basically COVID happened right as I was finishing nursing my second baby. Mm-hmm. And I had my risk-reducing surgery scheduled, and then COVID hit.
Oh, wow.
And that was wild because I'm married to a critical care physician. So out of nowhere, life turned upside down. My surgeries got canceled. He moved out because we had no idea what was coming. I had these two babies with me. And, in that year, we saw more death than I think either one of us ever thought we would in our entire careers as a physician couple. And then it was also the year in September of 2020, my surgeries got rescheduled. So I went to the hospital alone, did everything by myself because of visitor restrictions. I had a bilateral risk-reducing mastectomy with aesthetic flap closure. So I decided not to have breast reconstruction. And then also at the same time had a total hysterectomy, putting myself into surgical menopause at 32.
My gosh, I didn't realize that you had the surgeries as well during the pandemic and that your husband was a critical care physician. So you said that he moved out, meaning so that he wouldn't expose the family to the virus, right? He was staying somewhere separately.
So
a lot of people did that in healthcare.
He moved into
He moved into the basement or something. Yeah,
he did. He moved into the basement for like 10 weeks. And like, I remember packing everything into go containers and leaving his dinner on the front porch. And then he would come around and get, oh my God, what a wild time.
Yeah, a lot of people did things like that when they worked in healthcare. It was just dreadful and horrific. I mean, I lived by myself. So on one side, I was glad that I didn't have to deal with that. But then it was very lonely for me, very depressing to be alone during that time.
I'm sure.
Wow, so that's a lot. So so for the people watching that have a family history, but not as strong as yours, like how does someone know when they should ask their doctor for the BRCA mutation test, or when would they be a candidate to get that test?
Yeah, that's a great question. And it all comes down to awareness, right? And I think especially in cultures like ours, it's very taboo to ask questions of your elders, like especially when you're talking about disease and death and those sorts of things. At least in my South Asian background, it was so hard to gather the information. Lucky for me, I was a physician and obviously I knew my mom's history. And then, there was all these aunts and everyone through the years who had like stomach issues and like this issue and that issue. And so I was able to kind of piece it all together and encourage my mom to get testing. But I think for the average person, the first step is really to empower yourself with your family history. And that starts with asking your, family members, like, hey, does anyone have cancer? At what age were they diagnosed? What type of cancer? What kind of treatments did they get? Do we have a known genetic mutation? Has anyone gotten genetic testing before? Like, those are all of the questions you want to know, because that is where you'll really be able to find out, like, are there any red flags that you have a genetic mutation, right? And then you take that information, you take it to your doctor, and then you can kind of go over everything to determine, are you someone that seems to be at high risk or not? And then from there, I would recommend to go talk to a genetic counselor, and then they can do a full panel. They can help you map out your family tree and do a whole genetic panel for genetic testing. And of course, like, we live in an age where everything can be mailed to you, right? Including genetic tests, DNA tests. And I think, those are fine, but I think you just have to be very careful. The thing that concerns me about those sometimes is that, like, the 23andMe's is that you get it and it's not a full comprehensive genetic panel. So if you are worried that you might have genetic mutation or you seem to be high risk, and you get one of those tests and it's negative, it may just not have captured the gene you have, the genetic mutation you have. And so that's why I would be careful with those, because it might give you false information. And so I would really go, talk to a professional about it.
Okay, that's good to know, because there are so many at-home tests pretty much for everything now.
Right.
Okay, so they can get it done at their primary doctor, or is it a referral to a geneticist?
So usually the primary care doctor will refer to a genetic counselor, and then they'll order the full-on panel. And then, for people that are found to be high risk, now a lot of cancer centers have high-risk screening clinics for people who have the BRCA1 or 2 mutation. And now, with the advances in genetic testing, we found so many other mutations as well. So BRCA1 and 2 are the most common, but there are several others that also we know predispose people to, increased risk of breast cancer and ovarian cancer, just not as high of a risk as BRCA1 and 2.
Okay. Yeah, that's good to know. Yeah, I had my yearly mammogram this year. I don't like having it, but I get it.
Yeah, there you go.
So when the people ask, and we talked about this a little bit before, what are the guidelines for when they should start getting a mammogram and how often?
Yep. And the first disclosure I will make is neither Dr. Judy or I are breast health experts or oncologists. However, breast health is something that I am very, very passionate about, along with women's health. And so, at least going by the American Cancer Society guidelines, once you turn 40, you are eligible to get a yearly mammogram. That would be my recommendation. In addition to what you and I were talking about is body awareness. So although they don't recommend self-breast exams, I am a big fan of knowing you're normal and knowing, what is normal for your body and not, because once you do, then you can advocate for yourself. And I will say, being in the breast cancer community as a previvor or somebody that has a high risk of breast cancer, you hear from women all the time, young women who go to their doctors with a lump or this, that, or the other, and they are dismissed because they're too young, quote unquote, right? And so the more knowledge you have, the more empowered you're going to be to be able to advocate for yourself. So that's kind of the perspective I have on it. The other piece that I think, and there was some headlines on this recently, is that younger women tend to have denser breasts, right? So we have more fatty tissue, and denser breasts are also, cause an increased risk for breast cancer. And so if you are someone who's found to have really dense breasts on the mammogram, then you might be eligible for an MRI, which is a little bit more of a sensitive test. So that's something to also talk to either your breast radiologist about or your primary care doctor.
I'm so glad you mentioned about dense breasts, because I was going to bring that up too. I actually have dense breasts as well, so it makes me nervous, right? To even skip. And then just being in medicine in general, like I have several patients over the years that come into the hospital for a symptom and they've got like stage 3 cancer or like a mass or something that's not just like a nodule. And sometimes I just want like a full body scan. I know that's not evidence-based, obviously, but I love that you were proactive with regards to your health and took those measures, those precautionary measures.
And I think that was the biggest eye-opener for me. Yes, there's a lot of things that we can't control when it comes to disease risk reduction. And now I'm not just talking about breast cancer, but I'm talking about, other diseases as well. There are a lot of things that we can't control. For example, our sex. Like, you can't control being female. And why would you want to? Because being a female is amazing and women are rock stars, right? But like, you can't control your age, right? Aging is a natural process of life. And these are all unmodified. You can't control your family history. These are all unmodifiable risk factors for disease. But then this was the eye-opening part for me, which, I know you and I were talking about, like, a lot of doctors are waking up to this fact, but it's not something that most of us learned in medical school, is the power of using our lifestyle as medicine. I only learned that once I became the patient. And that was, I was 26 and they gave me this roadmap, like kids, bam, 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 surgeries. And I was like, okay, sounds great. I'm on board. It's all, that's what the science shows with this mutation. Yes, I'm going to do it, but I'm also 26. Like, I'm not
so
ready.
Young.
I'm not ready to do those things yet. Like, I still need to have kids. I need to nurse. I need to, finish my residency. I need to do all these things. So what is in my control today that will allow me to wake up every day and function as a normal human being and go to work to do something that is incredibly difficult, caring for dying patients for a living? Like, what can I do that is going to empower me to continue to live my life so that I'm not living in fear and anxiety all the time? And
that's so important.
Yeah. And it was crickets from my medical team. Like, I probably must have asked like at least 6 or 7 different people on my team, from the breast oncologist to the primary care doctor to the plastic surgeon to the genetic counselor. And every single one of them, at least 10 years ago, I hope it's changed now, but every single one of them said, you have a genetic mutation. There's literally nothing you can do from a lifestyle perspective. Like, your lifestyle doesn't matter. And the wild thing is, we know that couldn't be farther from the truth. And now we even have studies showing, not specific to breast cancer, but for colorectal cancer, showing that people that have a, genetic mutation that increases their risk of colorectal cancer, if they live an unhealthy lifestyle, it actually increases their risk of cancer even more on top of what their risk already is, compared to a person that does not have a genetic mutation. So that's something that I've become super passionate about, is advocating for genetic mutation carriers and empowering them with the knowledge and tools that, like, our lifestyle matters. And guess what? It's in our control, right? The food we're eating, the way we're moving, the substances hopefully we're not using, the way we're sleeping, like, all of these things are in our control. And so I went down the path that you went down, right? Like, Google.
Yeah.
What can I do to control? And that's when, I found Dr. Greger, and I found, How Not to Die, and I found, the American College of Lifestyle Medicine. And I discovered all of these things that, changed the entire trajectory of not just my life and my family's life, but the whole trajectory of my career. And so all of this comes down to this genetic mutation. And, while some would see it as like a death sentence, I'm like, gosh, it is the greatest blessing that I've ever received in my life,
I love that 100%. That's one thing that I've noticed that I feel about cancer care and even medicine in general. It doesn't empower people with tools of what they can do on a day-to-day basis. I don't think traditional medicine really understands and appreciates in the same way that, say, Chinese medicine does or like alternative medicine does, really understand the power of the body to heal itself, the power of nutrition and food, the power of like mindset, the mind-body connection, the impact of chronic stress, substances, not sleeping, even like social isolation, like the impact of the pandemic on our immune systems from that social isolation and stress.
And living in fear,
It's significant. Yeah, living in fear. Yeah, and that's one thing that I talk about. It's like if you've gotten a diagnosis and no matter how grim it may seem, you have to have hope. You have to believe that you can recover because otherwise your chances of recovering are a lot slimmer. Like you have to believe that you can do something about it, just like how you did. And that's similar what I did with my health issue. I didn't care how many people were saying that there was nothing that could be done about it or how many people were saying that they were in this state from that condition. I was like, that is not going to be my story. I'm going to figure out what I can do. And I think my mindset was a large part of it because it was a driver. And if I found a doctor that didn't give me an answer that I was satisfied with, I went to find somebody else who gave me hope and 100%, solutions.
100%. And that was like, throughout my career in palliative care, it was one of the biggest things I told every single one of my patients, because one of the first questions I would always ask them is like, what's important to you and what are you hoping? And sometimes they would say, well, it doesn't matter, or, what I'm hoping for is not going to happen. I said, even if what we hope for doesn't come to life, there's always something that we can hope for, like no matter what, right? There's always something to hope for. And I think, to the piece of mindset, for me, it kind of, like I discovered so many tools over the years. And just like you, like I went deep dive into mindset and how does our mindset affect our health and well-being. And it all boiled down to this for me. I was like, okay, wellness is a mindset first. Like unless you can, reframe your focus and your beliefs and the language that you're using, the story that you're telling yourself and the way that you're using your physical body. So your state, unless you can learn to manage your state, nothing else really mattered. And that was kind of what I learned through the years. Like, no matter how tough life got, like, I learned that you have the ability to manage your state. You have the ability to live in a beautiful state just by asking yourself quality questions, right? Like, is life happening to me or is life happening for me?
Yeah.
Everything in life is, for me, either a lesson, an opportunity, or a blessing, protecting me from something that maybe I'll never know about, or maybe I will, but just not right now, right?
That's such a growth mindset.
Yeah. And that's, on one end, when you're given a statistic like you have an 87% lifetime risk of getting cancer, and then on the other end, you have had the opportunity to learn from our greatest teacher, which is death. You develop that mindset because you live every day in a state of gratitude, because every day you wake up is a new day that, you've been blessed with, that you did nothing to earn.
Yeah, that's so true. And you saw your mom go through breast cancer and you were taking care of breast cancer patients. Wow. So how was that journey navigating being thrust into menopause? Because we never really talked about that, but I've been exploring the perimenopause, as I'm around that age and kind of looking into that. So what was that like?
So interesting you say that, because, as I started this journey and sharing on social media and everything, my focus in terms of the women I was talking to were genetic mutation carriers. There were women at high risk of cancer. And as the last 10 years have evolved, what I realized is like who I actually am is the modern woman, because the modern woman today is juggling so much. And you know this, right? These are the women you talk to.
Yeah.
They're juggling so much between their career, their children, their husbands, their, households, their aging parents. Like, all of some combination of the above. And because we're in a season of life as a society where we're having children later in life, oftentimes many of these women are navigating perimenopause at the same time, or menopause, and they're like, they don't know what is perimenopause and what is just, you know, early motherhood, right? The anxiety, the sleepless nights, the sweats. Like, when I say this out loud, people are like shocked. Like, I'm 40. What do you mean perimenopause? Like, yeah, perimenopause can happen 10 to 12 years before you hit menopause, right? And the average age of menopause, at least in this country, is around 51. So you could be having perimenopausal symptoms in your early 40s, but you could also have a 3-year-old in your early 40s today.
Right. That's very common.
Very common. And so menopause, it's become one of my super passionate topics to talk about, because this modern woman is navigating so much with her own health and she has no idea. She's just blaming it. She's blaming the brain fog and the anxiety and the chronic fatigue and all of that on just having young children and being busy at work. But it's so much more than that. And, you know, for me, it was a little different. I mean, I'm not going to be going through the natural perimenopause that most women will go through, because I intentionally chose to have a total hysterectomy. So I put myself in something called surgical menopause, which means one day I was having normal hormonal balance in my body, and the next day, you know, no estrogen. And so I think this is also where there's a plot twist, because menopause for me was my greatest fear before I decided to have this surgery.
Same. It feels like this doom. It's like, it feels like you're going through like this black cloud, like menopause. I'm so scared of it. Like, I'm going to get a heart attack. My cholesterol is going to go out. My bones are going to fall apart. You know what I'm saying?
Well, so it was all of that, but like, I wasn't, like, for me, I wasn't even thinking about all of that. Like, I was worried about it. Yeah. I was worried about my heart health, my bone health, my brain health. But you know what I was most worried about? I was worried about my sexual health, and I was worried about how that's going to impact my marriage, because my mom was 33 when she had cancer, and she went into chemical menopause, meaning chemo-induced menopause.
Okay.
And then at 40, my parents got a divorce. And when she was 40, my parents got a divorce after 25 years being married. And I only in the last 5 years did I put so many of these pieces of the puzzle together, where I was like, oh my God, like, because again, we're Indian, so we don't talk about this kind of stuff. And I finally had to like ask my mom, like, Mom, what happened? Like, after, you know, and she was like, well, you know, things down there didn't work, and I didn't really know. And I was so anxious all the time, and I was kind of lost in my own world, and we slowly just drifted apart. And I was just like, oh my gosh, like, you know, and at that time, and even today, but like at that time, you know, getting diagnosed with breast cancer as a 33-year-old young Indian immigrant woman, you know, without any social media or internet or support groups, everything happened behind closed doors. So like chemo, surgery, radiation, everything, menopause, divorce, everything happened behind closed doors. Like, she didn't have anybody to talk to. But in hindsight, like, now that I'm reflecting on all this, I was like, oh my God, okay, so my biggest fear is actually like, how is this going to impact my mood and my sexual health? And then what impact is that going to have on my relationship? Because if you look at the big picture, like, why was I choosing to have these risk-reducing surgeries? It was so I could do everything that was in my control to live like a really long life, to be here for my kids and have a beautiful, you know, family life.
Right.
But at the same time,
you don't want to be like miserable.
But at the same time, I'm like hit with this decision, like, okay, menopause, like, how's that going to impact everything? But then at the same time, I was a palliative care physician, and I was, you know, I'd seen so much ovarian cancer, and ovarian cancer scares me more than breast cancer, way more than breast cancer, because there's no good screening. And by the time it's diagnosed, it's usually late stage, and I've seen it in my family. And so, like, you can see all the different things that were hitting me at one time. And so ultimately, I did decide to go through with the hysterectomy, because I had an amazing gynec physician. And the day she walked into that office, she saw I was already crying before we even started talking. And both my husband and I were tearful. And the first thing she said is like, you are going to be okay. Like, you don't have to worry. Oh, she was amazing. You don't have to worry about everything that you're thinking about when it comes to menopause, because we have enough research now, and we have better interpretations of hormone replacement therapy than we did, in 2012 when the Women's Health Initiative study came out and everyone became so scared of hormone replacement. But the misinterpretation of that data really messed things up for a lot of women, in menopause. And so I am actually on a low dose estrogen transdermal patch, and I started it a week after my surgeries. And that in combination with my very, very intentional lifestyle, I actually have not had any of the traditional symptoms of vasomotor symptoms of menopause, like hot flashes and night sweats and all of that. So I am almost certain that it is not the patch alone, because I've met a lot of women who are in my exact situation who have the patch and are struggling with weight. Wow. They're struggling with anxiety. They're struggling with vasomotor symptoms. And so the patch is not enough. And that's where I believe, the lifestyle piece, the diet that we're eating, the way we're moving, all of these other things play such a huge role in managing not just the symptoms, the pesky symptoms of menopause, but also the consequences of menopause that you mentioned, right? Higher risk of heart disease, higher risk of dementia, higher risk of osteoporosis, higher risk of anxiety and depression. And, now I really am so passionate about talking about metabolic syndrome in women, because there is a direct link with breast cancer. There was a study that was recently done showing that women who were diagnosed with breast cancer, the more markers of metabolic syndrome they had, meaning if they had excess weight around the abdomen, if they had high cholesterol, high blood pressure, pre-diabetes, diabetes, these are all markers of metabolic syndrome. The more of these markers they had, the worse their prognosis of breast cancer.
Oh, wow.
So it is directly linked. We don't think about it, but it really is. And the beautiful thing is when you think about all of the tools in our tool belt when it comes to, our lifestyle, they really act to reduce the risk of all of these conditions, whether it be breast cancer, whether it be metabolic syndrome, diabetes, high cholesterol, all the things that come under metabolic syndrome, but then also the downstream consequences of metabolic syndrome, right? Heart disease and stroke and dementia and all of these things. So,
yeah, I love that you acknowledge, you have the genetic mutation, but you're not just leaving it at the genetics. You're also focusing on the lifestyle. And before I realized and studied about breast cancer, I thought most cases were genetic. And I also thought that there was nothing that the individual could do to lower their risk. And then I started reading about the lifestyle changes that people can do to reduce the risk of breast cancer. So what are some of the things that you started doing to reduce your risk?
So let me blow your mind. Let me blow your mind on the statistic first. So only 5 to 10% of the population actually has a genetic risk of breast cancer. Only 5 to 10% of people actually have a hereditary mutation. And when you look at the statistic of women that are actually diagnosed with breast cancer, I think it's around 87% of women that are diagnosed with breast cancer don't have a single first-degree relative that has had breast cancer.
So only 5 to 10% are genetic, and 87% don't even have a family history.
And that's wild, because when you ask someone, what's the first thing they talk about? They talk about their genetics, and they talk about their family history. And that's true for whether you're talking about cancer or diabetes or heart disease. Oh, it's in my genes, or I'm destined, but the reality is that, yes, genes run in families, but so do lifestyles.
Right, exactly.
Right? And for majority of
the population, you can modify what genes are expressed.
Yeah,
they're
exactly.
Like epigenetics.
Epigenetics, exactly. So those are the switches that turn on and off certain genes. Now, and we know 100% that things like our diet and exercise and the way we're sleeping affect, these epigenetics factors. But I think it's so important for people to realize that, it's not, the lifestyle piece, it does not just affect one disease state. You can throw all of these disease states pretty much into the same hat. And the lifestyle piece, it's like one drug to treat all of them, right? Reduce our risk. And you talked about this earlier, is that the way that we're trained in conventional medicine is we're really managers of disease.
Yeah.
Right. So we wait until someone is diagnosed with a disease state, and then we work to manage it with medications, with testing, And what we're really doing is we're just slowing down the progression of that disease. And as somebody who worked in palliative care for 10 years, I can tell you that almost every single one of my patients I took care of at the end stages was on medications for like 3 to 4 decades for things like high blood pressure and cholesterol and diabetes and, whatever the condition may be. And none of them were, quote unquote, treated. None of them were reversed. They were just managed. And so it just slowed down the progression of the disease. And so that's why it's really important. Like, yes, if you're okay with that, then that's fine. If you're okay with knowing that, if I'm treated for diabetes for 30 years with insulin and metformin and all the things, if you're okay with knowing at the end of that third or fourth decade, you're probably going to have a massive heart attack or a massive stroke or need an amputation or lose your eyesight, then that's okay because you're well informed and you're okay with that. But if you are listening to this and you're like, wait, what? Right? Like, you're not
like, how can I have a heart attack and have a normal blood pressure or a normal cholesterol?
You're not just healthy one day and then you have a massive heart attack. It's these silent killers over many years that lead to these downstream consequences of the heart attack, of the stroke, of the cancer, of the, amputation or whatever it is. And these silent killers are a lot of the things that you and I were talking about, right? Like our weight and cholesterol and blood pressure and our blood sugar and our stress. Oh my God, that's a big one, right? And I know that's a big part of your program is this chronic low-grade stress, increases our risk of heart disease and cancer and all of these things. So to go back to your question of like, what did I do? The first piece of the puzzle that I'll just give you a caveat before I go into this, because what you're going to be able to do, whoever's listening to this, what you're going to be able to do in this season of your life is going to be very different than what I'm doing or what Dr. Judy's doing or, what you might be able to do 5 years from now, because every single one of us is in a different season of life and we have different things going on. And I think what's important to take away from this part of our talk is that there's a lot in your control, and taking even one piece of that, is going to make a big impact down the road, even if it's just a little bit of a lifestyle change you're bringing in. And so, when I was 26 and I was like also trying to get pregnant and take care of dying patients and doing all the things, for me, it was like, okay, let's start with diet. Like, let's look at that first. And it just so happened that we were doing life insurance because we wanted to get life insurance, before about the genetic testing and all that stuff. So we did life insurance. My husband was 34 at the time. Like I said, critical care physician, lean white guy. Like you would think he looks very healthy. But we got blood work, and who knows when the last time he got blood work was, right? And so the blood work showed we both definitely gained weight during residency because we know hospital food is the worst,
unhealthy
right? Yeah,
food.
He gained about 25 pounds during residency. I gained about 15 pounds during residency. So this blood work showed that he had high blood pressure, borderline high blood pressure. He had high cholesterol, and he was pre-diabetic. Now, if anybody saw him, you never would have guessed that that's what his insides looked like. And that is just another point to say, like, just because you don't feel something doesn't mean it's not there, right?
Yeah.
And then he was also hospitalized twice for severe constipation. That's how bad his gut health was. So his metabolic health, his gut health was a hot mess. And my numbers were not that bad, but I was also 10 years younger than him. And so for me, it was like, okay, it kind of took a little bit of the attention away from me and more on him, because I was like, dude, this is not good.
Right.
So
you're like, what's happening?
Right. So then that's where, again, I found Dr. Michael Greger, literally read How Not to Die 3 times in a row. We started to incorporate, cooking at home. We got Blue Apron. So neither one of us knew how to cook. So we started these meal delivery services, started learning how to cook. We started eating more plant-based. So we went vegetarian after our wedding. And then 3 years later, we went fully plant-based vegan and haven't looked back since. So it's almost been, 10 years since we went vegetarian and 6 years since we've been plant-based. And my kids are fully plant-based. They don't know anything.
Plant-based.
They don't know anything
Have they
different.
always been fully plant-based? Like they've never eaten meat or dairy?
From conception.
Oh, wow. I'm sure you get that question a lot. Like, how do you raise plant-based kids?
Well,
so y'all got married and then you basically just like hit the ground running with all of these health challenges that you were like tackling?
We laugh about this all the time because my husband's like, I had no idea what I was signing up for when I married her. But it's crazy. So, we like right from the get-go, we found out those numbers. We basically did a 12-week coaching program because we needed the help.
Yeah.
We did a 12-week coaching program, and we learned about time-restricted eating. We learned about plant-based nutrition. We learned about strength training and all of these things that can help with metabolic health.
Yeah.
And literally by the end of the 12 weeks, his blood work showed improvement in his blood pressure, his cholesterol, and his prediabetes was gone. And he had lost about 20 pounds. I had lost about 12 pounds. And we're in the same metabolic health today as we were 10 years ago.
Oh, nice. That's amazing.
Yeah. So, and then over the years, everything else layered on top of that. So the nutrition piece was really first for us. And then after my surgeries, because remember between 27 and 32, I was really in like the fog of like motherhood. I was either pregnant or breastfeeding pretty much that whole time.
Right.
After my surgeries is really when I took the other pillars more seriously. It started really with my exercise. Like there was a period after surgery where I was so debilitated because I had, unfortunately, a major complication. And so actually what ended up being way weaker than I thought I was going to be after surgery. And I had drains and, had a top surgery and a bottom surgery. And so I couldn't walk or get to the bathroom or go, do all the things. And for a good 2 weeks, 10 days, I was dependent on my husband to shower me and take me to the bathroom and like do all these like basic things. And for like just a short little while, I had get goosebumps every time I talk about this, but like I had the experience of what it was like to live in the body of one of my like really sick patients. And that was really hard, like not being able to use the bathroom, not being able to pick up my kids, not being able to do all these things that like, most of us take for granted, right? That's the gift. And so for me, it was like this one day I was sitting in a recliner and it was getting dark out and then everyone was downstairs, didn't have my phone. I had to pee so bad. And finally my husband came up and I was like sitting in the dark crying. And that was the day I was like, that's it. Like, this is the day that, my self-care becomes my self-preservation. And the day that I get cleared to move from my surgeon, like I will not stop moving because it is such a gift. It is such a gift. And really since then, now it's been 4 years, unless I've been sick or something crazy in my life, I have moved my body every single day in some form or the
That's
other.
so good. And that reduces the risk of breast cancer too. Exercise,
100%.
also healthy, plant-based diet, not smoking, a healthy body weight also are ways that you can like reduce your risk of breast cancer. And
Not
it's like,
smoking.
these things are so important. Yeah, not smoking. So yeah, there are things that people can do. So we talked about getting screened, healthy lifestyles. And then I wanted to touch on the menopause piece because in 2020, it was pandemic. I was turned 40 that year. Super stressed out. I was working in the hospital. It was probably like the worst year of my adult life, 2020 to 2022. And it never occurred to me that I could have been going through perimenopause. And it's not until this year that I've been looking into this, actually. And I read that book, The Menopause.
The New Menopause?
Reset? Yeah, The New Menopause by
It's
Dr.
so
Marie
good.
Claire Haver.
It's
I've been
so good.
looking at all her stuff. So a menopause expert, because I realized that not only do I not know anything about menopause and perimenopause, but even OBGYNs don't, because I've been asking them and I saw one.
Yep.
And she asked me one question, which is not good enough. She asked me, are your periods still regular? And I said, yeah. She was like, okay, well, you're not going through menopause and you're not going through perimenopause. And I'm like, that's not correct.
Yeah.
It's
like asking a primary care doctor about lifestyle medicine. That's how I think about it.
That's a good analogy. So for those of you that are watching, ask your mom, when did she go through menopause? And then count back like 10 years before that. Like, are you at that age? And you can see your OBGYN, but if they're not certified in menopause, I forget what this is. It's a certification, certified menopause specialist. Yeah.
NAMS certification.
I would actually personally recommend to see a certified menopause specialist because the knowledge that she gave me and her confidence, it was just like night and day. Like I had so many questions. The visit was amazing. She educated me so much.
Yep.
And it just provided reassurance.
Yep. And it's really like the menopause expert is the one that will tell the modern busy woman that she's not crazy. because
Yeah.
symptoms of perimenopause are not just the typical symptoms you think of it with menopause of like heart disease, brain and bone health risk, and hot flashes and night sweats. Like that's what we think of when most of us think of menopause, but it's so much more than that. It's insomnia, it's brain fog, it's anxiety, it's depression, it's joint pains. Like there's so many random symptoms of menopause and perimenopause that we don't think is menopause.
Yeah. And the crazy thing is that your blood work would be normal. Like I have all these symptoms, had or have at some point or another. My blood work has always been pristine. So I'm like, what's going on?
Right. Yep, exactly. And for me, like going back to the menopause piece, like that was where, like when I knew I was putting myself into menopause, that was where I was like, okay, let's go above and beyond the basic pillars of lifestyle medicine and see what else is out there, right? Like, let's go beyond food and exercise and sleep. And so I will do all of those things, but what else is there? Because I was desperate. I like wanted to know about everything so that I was ready. Like if menopause hit me like a raging, I was ready. I knew what I was going to do. And I read all the menopause books. I did all of that. So I was equipped. And so that was then when I discovered, the healing benefits of things like sauna and infrared light and things like cryotherapy and fasting I was kind of already doing, but really doing more like a prolonged fast, like ProLon, like the fasting mimicking diet. So that was really where I started exploring these things and like game changer, total
So
game
fasting
changer.
helps with menopause symptoms?
Well, fasting can help if you're menstruating because of the hormonal fluctuations, but in menopause, because of the changes with estrogen and your increased risk of like, particularly looking at it from a metabolic syndrome perspective and all that weight gain that women talk about in their midsection, fasting is amazing for that because fasting really allows our body to use our stored fat for fuel. And I'm not even talking about like extreme fasting. I'm just talking about regular time restricted eating, anywhere
like
from
intermittent fasting.
Yeah, like 12 hours or 14 hours, like something around there, depending on what your needs are, right? So for me, it really helped with that. But then also from a mental health perspective, like people think they need to eat to get energy. But the reality is when we eat, because in the American standard diet, most of us are eating the wrong foods. We're eating too much of the wrong foods and we're eating all the time. We actually are never satisfied. We're always having cravings. We're always feeling tired. And so once you start incorporating that fasting piece, it has a huge impact on your mental health and your mental clarity and energy that you get, focus. And so that was one piece of it, the time restricted eating. And it could definitely help with the PMS, like the menopausal symptoms as well, the mood. But then I also started playing around with ProLon in 2019. And that for me, so for anyone that doesn't know what ProLon is, it's a fasting mimicking diet.
Can you share about that? Because actually, I have a link to share. And you also told me about ProLon, and I'm just now looking into, because I teach fasting, as you know.
Yeah.
And then when you told me about ProLon, I was like, oh, okay, so this could be for someone who maybe can't actually fast, but it like mimics fasting. So can you share about ProLon briefly, if you don't mind?
Yeah. So when you think about time restricted eating, right? People think of that, also another word for that is intermittent fasting. But then you have more of a prolonged fast, right? So when we talk about prolonged fasting, that's like, when you're going beyond, 1 day, 2 days, 3 days, 4 days. And, most people think of water only fasting when they think of prolonged fasting. And the caveat I'll put out there is that I wouldn't recommend water only fasting unless you're under medical supervision, because it increases your risk of electrolyte abnormalities. Who knows what your underlying medical problems are, increases risk of muscle loss. So that's when I actually found out from a lifestyle medicine colleague about ProLon in 2019. And the thing about it that got me interested beyond the mental health, beyond the metabolic health, and beyond the gut health benefits was really the cellular health benefits. Because as a genetic mutation carrier, I can't control my genes, and sure, I can control all my lifestyle factors, but this was a way for me to tap into rejuvenating my cells. And that is science-backed, with 20 years of research at the NIH. This was really cool. So what it does, in around day 3 of a fast, it basically taps into something called autophagy. And autophagy is, when you're in a fast, If your body doesn't have sugar anymore, it's going to start burning fat. And eventually it'll start looking internally and it'll start looking for like damaged cells, damaged organelles, damaged proteins, and it'll start eating those up. So it's your body's internal recycling system is the way I like to think about it. But the only best way to tap into it is with that prolonged fast. Now, like I said, water-only fasting can be dangerous. And that's where ProLon or the 5-day fasting mimicking diet comes in, where Dr. Walter Longo has studied and created this like patented program where you're kind of tricking the body. So you're able to eat and drink certain things in this kit that they give you. And, it doesn't activate your body's nutrient sensing pathways. So it's just enough to like kill your hunger, but not enough for your body to realize you're eating. And so you get all the benefits of a 5-day fast.
So during the 5 days, you're just eating the ProLon kit stuff.
Yeah, exactly.
Okay, that's pretty cool. Yeah, I'm definitely going to try it because I want to do like a 3-day fast or maybe even at least 3 days, but I like for people that are even metabolically healthy, I've read that it's good to do like a prolonged fast for like 3 days, 5 days, 7 days, whatever you can tolerate. So that's something that I'm going to actually look at.
It enhances your metabolic flexibility, right? Your body's ability to burn sugar and fat, but then also the cellular health benefits. And then on day 5, on day 6, when you eat, like when you put that first bite of food,
back to regular food.
Yeah, when you put that first bite of food into your mouth, it is such a like, oh my God, it is like the best thing you would have ever tasted. Like it is such a great exercise in intentional eating. Because most of us are just we're surrounded by food. So we're constantly just eating just to eat. But this is like just a great program to like reset and break bad patterns. Now, again, disclaimer, this is not for everybody. And, if you have a history of eating disorders or your BMI is very low or you have a lot of medical health issues, and I would recommend this unless you talk to your doctor. But for everyone else who otherwise doesn't really have any major issues and is looking to optimize their mental health, their gut health, and their metabolic health, and their cellular health, this is a great tool. So, there's daily fasting and there's that prolonged fasting piece. So
how often do you do the 5-day ProLon fast?
I do them 3 times a year.
Okay.
Because
that's what I was thinking, like once a quarter, something like that.
Yeah. And I think it's such a gift for me because it's the only way that I can, if my body doesn't have the ability to recognize like there's a mutated cell, then this is one way that I can empower my body to like destroy those bad cells. Like autophagy basically means eating yourself in the sense.
Yeah. So, when I discovered about fasting, I was literally blown away. I was like, how have I not learned about this before? I started doing water fasting. Someone told me it could help me. This was last year. So I did like a 24, 48 hour one. And then somehow I just started doing intermittent fasting. So now I do that every day. I only eat 2 meals.
Yeah.
And it's significantly helped with my cravings. I really don't have cravings unless it's my period, the week before. Yeah. And that's obviously hormonal, but I don't have cravings. I had belly fat from the pandemic, then that went away. I feel like I have so much more energy. So I'm like, I will never go back to eating 3 meals a day because it just feels like too much food now.
Yeah. Yeah. No. And it like once you start living this lifestyle and you feel good, you don't want to go back. And so many of us are just so used to feeling bad all the time that when you actually get a taste of what feeling good feels like, you're not going to go back.
Yeah. But so many people don't even know that it's possible. So that's why I just love the fact that, you're on social media, I'm on social media. And so with this podcast, I like to give people hope, tools, empower them that there's so much that you can do beyond the doctor's office, beyond traditional medicine, and even like you touched on, beyond diet and exercise. I thought everything was diet, exercise, and sleep, but there's like so much more healing therapies that exist. Like you touched on, like fasting, infrared, so much.
Strategic supplementation. I believe in all of it. And I know it's, like you said, at some point I was of the camp as well that like lifestyle is it. However, in my career working in palliative care, and I don't know if I told you this or not, but I officially left my job in July. So I am no longer working in the corporate medicine space. a big, big change.
Congratulations for
Thank
that
you.
risk,
You risk.
leap of faith. It's a jump. That's a bold move, but I'm there, so I support you.
I'm going to call it an opportunity.
Yes.
But also just, the recognition that I serve the most vulnerable and sickest patients for, 11 years of my life. And there's a season for it. And I'll tie this back to two things. Number one is that in the end here in the last several years, I lost satisfaction in my job for many, many reasons. But one of the biggest reasons was because I started to learn all of this. And the people that I was taking care of were getting younger and younger and sicker and sicker. And, 80% of the conditions that I was, they were dying from were lifestyle related and completely not, I won't say 100% preventable, but these people didn't have to be in these positions. And when I'm saying younger and younger, I'm saying most people were thinking that my average patient's in their 90s, right? Because that's what we think of when we talk about a dying patient. But it's not uncommon for me to have patients in their 40s and 50s, with end-stage diabetes.
That were dying?
Yeah, that were dying or waiting for a heart transplant or whatever. Now children are being treated for high blood pressure and high cholesterol and diabetes, right? And so if you think about what we were talking about earlier, these are silent killers. And so if you're diagnosed at 12 or 13 with high blood pressure, high cholesterol, and prediabetes, 3 decades later, you're in your 40s. And so now you're going to get the massive heart attack. You're going to get the stroke. So that's what's happening to our society. And I saw a report recently that was saying, if you look at the 9, most established countries in the world, America ranks last in all major key health measures. Americans are getting sicker and they're dying younger for so many reasons. But a big part of it is our lifestyle, right? So
we spend the most on healthcare.
And that was the other piece. We spend the most on healthcare, yet we're getting sicker and sicker. So the question is why, right? And that comes back to doctors are managers of disease. They don't actually treat the root cause. So that was kind of one piece of it, and I completely forgot the other thing I was going to say, but it was a good point. But
it'll come back. Well, no, this is so true. The power of the individual. I had a similar journey. Our stories are so similar. We're like kindred spirits. I started to get frustrated with the cycle of what it seemed like where people were continuously coming back into the hospital with the same problem, and then they basically spiral down towards end of life. And at that point, you can't stop the train. So that's why I got on social media to share that information with people about how powerful food is. So we just have to keep sharing the message, keep empowering people, and hopefully, traditional medicine will catch on. I think it's starting to catch on. The American College of Lifestyle Medicine has grown in membership. There's more doctors, more providers that are getting certified in it. There's also functional medicine certification, and then there's a integrative medicine fellowship as well. So I believe that change is coming. There's always hope. So I love it so much that you have shared with our audience today.
What I was going to share with you on a closing thought was part of the reason why I decided to leave also is I made a connection, or I asked myself a question, because I've had chronic back pain since what I thought was after labor from my daughter. And so it's been seven years of dealing with chronic back pain. And that was part of the reason why I was exploring all these other things too, like the sauna and cryotherapy, and to see if it could help with my chronic pain. Because I did all the physical therapy, I did all the massage, I did all the strength training, and nothing was helping this pain until one of the therapists I saw said, "Do you think your pain could be related to the work you do?" And I was like, wow, I've never thought about it like that. And the crazy thing is that the same year I had my daughter was the same year, I was just starting my fellowship, my work in palliative care, but I never really made that connection. And in April of this year, when I gave my notice to the hospital, and I'm not even exaggerating, without changing anything else, my back pain has gone down by 90%. And that is
before you even left.
Before I even left, just giving my notice, throughout April, May, June, July, my pain went down by 90% without changing anything else I was already doing. For
clarification, you were not lifting heavy patients or anything like that, right?
No. But what I was doing was sitting with people and getting a front row to life's most difficult moments. I was dealing with a lot of angry patients, a lot of frustrated patients, because as you can imagine, these people have been in this broken healthcare system for a very long time. And as a palliative care physician, you know, I'm probably one of the first physicians that they're sitting down with who's actually giving them the time of day to express themselves. And so almost the first 20 to 30 minutes of every patient encounter was them unleashing. And, you know,
some of them probably feel like they were diagnosed late, I'm sure, probably.
there were so many. Yes, so much of that. And
so
just
hard.
a miscommunication, just so many things that make it hard to be a patient in our healthcare system, which I experienced myself, and I'm sure you did when you became the patient, right? And so, like,
it's a disaster. I was like, what is happening?
Yeah. And I think the hard part about palliative care was that, you know, like, I believe in a lot of healing prayers, and, you know, I'm a big proponent of the 𝗪𝗹𝗵𝗁 prayer. I don't know if you're familiar with it. It's a ancient Hawaiian healing technique. And in a way,
say it again?
𝗪𝗹𝗵𝗁. I'm sorry.
Okay. I'll have to look it up.
Yeah. I'm sorry. Please forgive me. Thank you. And I love you. And so I did that a lot for my patients and for myself to kind of protect me and all this stuff. But even then, like, the amount of anger and rage and frustration people had, not just because now their loved one is dying, but because of the years of, like, struggle they went through, right? Like, they're unleashing that on me.
Oh my gosh.
And, you know, at some point you internalize it. And I never really thought that that's what I was doing, because on a day-to-day basis, I'm a very happy-go-lucky person. You would never think that like I'm internalizing it. But after I gave my notice, and by the time I left the hospital in July and my pain was almost gone by 90%, I was like, holy moly, it's insane the impact that this, like, subconscious stress or this subconscious emotional burden can have on our physical body. And again, it's that silent thing. Like, you don't feel it at a conscious level, but at a subconscious level, you know, our emotions, our, you know, the things that we're holding on to, grudges, like, you know, all of these things have such an impact on our health and our physical symptoms. So I thought I'd bring that up because I know you have your own health journey and everything. And these are all the silent things that most of us don't give enough credit to. But, like, when you look at a person on a holistic level, you know, mind, body, spirit, it matters so much.
Yeah, it does. And I literally released an episode on my YouTube about this yesterday, the impact of the mind-body connection. Your story is exactly like mine. The day I gave you my notice, many of my symptoms lifted and got better. And I've basically... I would take time off, go back to work, the symptoms would come back, take time off, go back. I kept doing that for like 2 to 3 years. And then finally, you know, I completely walked away, and I have not been sick like that ever since. So
I hear
and there's many other people like that, especially physicians, I believe. I don't know if it's because we have a high tolerance to stress, and, you know, we wear it so well that we're not even really aware of the fact of how it's impacting our body on a cellular level, because we don't even understand that the mind impacts the body. It's very fascinating to me.
Yeah. No, for sure.
So thank you so much for sharing. This has been so much fun. When I come to your city, or when you come to my city of the Ava we dedefinitely have to link up, go for a lunch or something, because I love chatting with you. And thank you so much for sharing. We'll have the links to your website, which I was checking out earlier, and your Instagram. We'll have that there so that they can contact you and find you. But can you just share the website and your Instagram for the viewers?
Yes. So my Instagram is at Dr. Simran.Malhotra, and then my website is CoachSimranMD.com.
Awesome. Well, thanks so much, and stay safe. All right. Bye.
Bye.